Hello, my name is Sarah Busab, and the topic of my presentation is how abuse and neglect affects a child's development. Before this developmental psych class, I had always assumed that the way a child was raised would affect them as an adult, but I just did not know how much it could affect them. Healthy relationships and healthy development are so important in a child's life. Healthy development means that children of all abilities can grow up with their social, emotional, and educational needs met. This also includes having a safe and loving home, spending quality time with family, and playing with other children. An abusive household may consist of one or both parents being depressed, impaired by alcohol, emotionally distant, or unavailable, as well as being physically absent for long periods of time. This causes children to receive a lack of attention and affection. They may also not receive the discipline and guidance that are needed to become mature and fully functioning adults. There are many what ifs when a child grows up in an abusive household. Since the environment they live in was not affectionate, they could develop into people that are devoid of empathy, which can cause them to have trouble in adult relationships. And also, since the relationship at home with their parents lack love and attention, they might look for that elsewhere. In an article called The Effects of Abuse and Neglect on Child Development, which was published by Cambridgeshire and Peterborough, talks about the 4 child development domains. This includes physical development, cognitive or intellectual development, emotional development, and social development. Physical development includes body growth, increases in height and weight, and the development of secondary sex characteristics. Cognitive or intellectual development includes the way a child processes information, solves problems, and develops thoughts, judgment, and perception. Social development includes the interaction with other people in social groups or settings. Examples of some social tasks are developing a moral system and creating relationships with peers and adults, and adopting group values. Emotional development is the development of personality traits and characteristics. This includes the creation of a personal identity and self-esteem, as well as the ability to trust and establish independence. Some normal developmental milestones that are seen in infants and toddlers include the 4 domains: physical, cognitive, social, and emotional development. Infantry to toddlerhood is considered birth to 3 years of age. From birth to 1 year, a child should develop control and mastery over one's body in both growth and fine motor skills. And from the ages of 1 to 2, they should develop coordination, balance, stability, and improve the ability to manipulate objects. And from the ages of 2 to 3, they should develop increased strength and use motor skills to master challenges in their environment. Normal milestones in emotional development include development of basic trust and a positive attachment between the infant and the caregiver, and this should be seen from birth to 1 year old. And from the ages of 1 to 3, They should develop a sense of autonomy as well as mastery and control over oneself and one's environment. Some cognitive developments that should be seen include alertness, awareness, recognition, and interest in visual, auditory stimuli. And this occurs from birth to 1 year old. And from the ages of 2 to 3, they should begin to perfect their language skills and use that language to talk and communicate with others. For social development, infants from birth to 1 year old should develop an attachment to their primary caregiver, which most often is their mother. And that's probably the most important social task that can be seen before a child is 1. From the ages of 1 to 2, they develop trust and they begin to have affectionate and trusting relationships with family members and adults outside of their family. And from the ages of 2 to 3, they should have basic relationship with other children. They should be playing with other children, but not necessarily doing the same things as other children. Now, maltreatment on child development is a really important topic because, as seen in the graph, from the ages of 1 to 6, there really is no decrease in the level of maltreatment a child receives. And just looking at the numbers on the graph, over 20,000 kids, at least in Canada, were maltreated. Now, let me pull up my other graph. Effects of maltreatment on child development includes the 4 domains that I spoke about earlier. For physical development, a child who is abused or neglected may suffer from chronic malnutrition, which is the lacking of vitamins and basic nutrients that a child should receive every day. And this can cause stunted brain growth as well as body growth and can potentially lead to mental retardation. Children that are abused tend to receive a lot of head injuries, injuries to the hypothalamus and pituitary glands, and repeated blows to the head. Now, these blows or slaps to the side of the head or the top of the head can cause potential partial or complete hearing loss. They can also stunt growth, like I said earlier, can cause comas, paralysis, potentially death. These children also receive medical neglect, which is withholding treatment for treatable conditions. And these can lead to permanent physical disabilities. For example, if a child is suffering from an ear infection, but it goes untreated, they can potentially experience hearing loss. The same thing goes for their eyes. If they do not go to the doctor for, let's just say, glasses, they can end up with a cross eye. And another example could be respiratory diseases or respiratory damage from untreated pneumonia, bronchitis, strep throat. They also suffer from absence of stimulation, and this can cause delays in both social, emotional, and cognitive developments. For example, the absence of stimulation can cause a child to have language and speech delays, and this can cause them to fail to use language to communicate with others. And honestly, some children won't talk at all. These abused or neglected toddlers may not develop play skills and cannot engage in interactive play. They may also be depressed or not develop separation or stranger anxiety. There are a lot of companies and volunteer work that tries to help and catch these abuse, neglected treatment cases early on, but not every child will receive the help they need in order to grow and be mature adults.